there you just mentioned that you can use AMH testing for the diagnosis of PCOS. How do you do that?
Yes, so in terms of PCOS, women with PCOS have very high AMH. The AMH cutoff in the future probably will be incorporated one of the criteria for diagnosis of PCOS. At the moment, it is not part of that criteria. And in PCOS, you have two of those three things. Either you have irregular period maybe every 2-3 months, and symptoms of high androgen, and also on ultrasound you have multiple follicles, so multiple antral follicles, which means you have more than 20 antral follicles on your ovaries. So if you have out of these three, you are diagnosed with PCOS. But AMH is used as additional test to diagnose or screening for PCOS. For example, in women with a PCOS, AMH is generally higher than 25 picomole liters. So if you have symptoms of PCOS, like irregular periods, symptoms of high androgen, and if your AMH is low, it's very unlikely that's PCOS, or you had the PCOS in the past, now it's resolving. So what happened, like we discussed yesterday, women with PCOS have a PCOS when they're younger. As they get older, their egg resolve drops, their antral follicle number drops, their AMH drops, then PCOS symptoms resolve. They start having regular period. When they do scan, the ovaries don't look like PCOS ovaries, and symptoms of high androgen will go away. So because their egg resolve is dropping. So women who had a PCOS in the past, and when they're older, when they measure their AMH, if it's low, let us say their AMH is 15 picomole liters, probably their PCOS is now resolving. So, or they don't have a PCOS, they were diagnosed with PCOS, very unlikely they have PCOS. Why? Because in women with PCOS, like we said yesterday, they have multiple follicles on their ovaries, and then those antral follicles produce high level of AMH. So on the scan, they have at least 20 follicles on each ovary, maybe 40, 60, 70 follicles on the ovary, and those follicles should produce AMH. So that's why AMH levels should be high. In the past, when ultrasound was not developed, like let us say 50, 60, 70, like even 100 years ago, PCOS was diagnosed by the person called Levenstein. So that person, when they did the operation, he could see lots of tiny follicles, and he thought these were tiny cysts. This is why he said polycyst, multiple cystic ovaries. So, and actually these are not cysts, these are antral follicles. Now we know that's antral follicles, that's normal. Just quantity of antral follicles high, and this is why these antral follicles producing high AMH levels. Yeah, so in PCOS, you have one of the tests you do if you're not quite sure whether it's PCOS or not PCOS.